Hello everybody and welcome back to TORN. If you're a medical professional, athlete, parent, coach, or anyone just trying to understand what the ACL injury is, this video is for you. This injury can be a little bit hard to understand at times, so in this video I'm going to break down very specifically what the ACL is, where it's located, and what it does or its job. So let's dive into it. So the first question that we want to answer is, what is the ACL? So if we break down that word or that abbreviation, ACL, it will actually tell us a lot about what it is. So the ACL stands for anterior cruciate ligament. So let's break down that word a little bit further. So the first word that we want to break down is anterior. So what does anterior mean? Well, when we look at the body, we can break the body down into front and back, side to side, top and bottom. The word anterior just means in front of. So when you see this image, you can see the front and back. The anterior portion of the body, or as it relates to the body, is parts of the body that are in front, right? So when we look at the ACL, inside the joint, we have two different ligaments, the ACL and the PCL. The ACL, or the anterior ligament, is the one that's in front or closest to the front of the body. The PCL, or posterior cruciate ligament, as you can see in the image, posterior means behind. So when we look at what's going on inside the knee, those two ligaments that are placed inside there, the ACL and the PCL, the anterior ligament, or the ACL, is the one that's in front of. So next we have cruciate. So anterior cruciate ligament, what does cruciate mean? Well, the word cruciate is actually Latin for cross, or something that crosses each other. So when we look inside the joint, as you can see the image as well, as we discussed, we have the ACL and the PCL. So these are the two main stabilizer ligaments of the knee joint itself. So when we look inside the knee, you can actually see that the ACL and PCL actually form a cross. So when we go to designate what these terms mean, we actually see that those two ligaments cross each other. So cruciate meaning cross. When we go inside the knee, that's how we can kind of delineate the two of those. So lastly, we have ligament. So anterior cruciate ligament. A ligament just means that you're attaching a bone to a bone. So anything in the body that is connected by two bones, a ligament actually stabilizes those two bones together. So conversely, when we look at something like a tendon is something that attaches a muscle to a bone, so slightly different. What we're attaching with the ACL or the anterior cruciate ligament is we're attaching the femur or the thigh bone to the tibia or the shin bone. So the next question that we want to answer is, where is the ACL? So obviously, as we've seen, the ACL is somewhere inside the knee, right? But what is the knee? So the knee is comprised of the femur, the tibia, and the patella. So when we look at this knee model, right, the ACL is going to be somewhere in there, right? We want to break down this knee model anatomically. So I'll turn it to the side slightly. This here is the femur or the thigh bone. This bigger bone down here of the two is the tibia or the shin bone. If I turn this around, there you can see the patella or the kneecap. The ACL is somewhere inside this joint. So if we open this joint up, there's where we can expose some of the ligaments. So I'm going to put my marker just behind the ACL. So there's your ACL right in front. So if we break down that abbreviation again, anterior cruciate ligament, anterior just means the ligament that's in front of. So the ACL is what I have my marker on here. If I turn this model around, you can see that the PCL is right here, right? So posterior cruciate ligament, posterior meaning behind. The anterior cruciate ligament is the one that's in front, okay? So the next term we have is cruciate. So cruciate, as we discussed, means cross. So if I open this up and rotate it, there's where you can see the ACL and the PCL crossing each other. So the cruciate part meaning cross, and that's how we delineate the two inside the joint itself. The last term is ligament. So ligament, as we discussed, is attaching a bone to a bone. So in this case, we see that the ACL is attaching the femur to the tibia. As we can see a little bit in this model, that the ACL itself attaches or originates kind of in the back of the femur and attaches to the front of the tibia. So the last question that we want to answer is, what is the job of the ACL and what does it do? So primarily, the ACL's job is to stabilize the joint. So along with the PCL or the posterior cruciate ligament that's in back of the knee, those two ligaments are designed to stabilize the knee. So when athletes move at very high levels, when they're jumping, landing, cutting, decelerating or changing directions, those two ligaments within the joint are designed to help keep the knee intact. To be a little bit more specific about the job of the ACL, let's go back to looking at the knee model. So the primary role of the ACL is to resist the tibia moving too far forward on the femur. So if you look at this model, an ACL that is torn or a deficient ACL, you will see a huge shift of that tibia on the femur itself. So the ACL's role is to prevent that. A secondary role of the ACL is a little bit more controlling a rotation of the knee. So going back to cutting, pivoting, shifting, all of these different movements that athletes make, the ACL acts as a secondary stabilizer to resist too much rotation. So if you're looking at this model, this is a right knee. So the ACL's job is to also prevent secondarily a little bit of a rotational piece. So when you're on a planted foot and you have to do some sort of rotation or cutting motion, the ACL acts as a secondary stabilizer to resist that rotation. So to recap, the ACL, or the anterior cruciate ligament, is a ligament that sits inside of our knee joint. The knee joint consisting of the femur, the tibia, and the patella or the kneecap. That ligament's job is to help stabilize those two bones together. Specifically, the ACL's job is to resist the shin moving too far forward on the thigh bone. A secondary role of the ACL is to resist some of that rotational piece that we discussed with the knee model. If you found this video helpful, subscribe to the channel and share with anyone you know who may be going through an ACL injury and wants a clearer understanding. In the next video, we discuss the signs and symptoms of an ACL tear and what to look for. So click that link above and we'll catch you guys in the next video.